Bon après-midi tout le monde. Good afternoon, folks. My name is Maxime Lee, and I will be your moderator for today. Je m'appelle Maxime Lee et je serai votre modérateur aujourd'hui. Merci d'être parmi nous pour ce point de presse. Thank you for joining us for today's media availability. In case this is your first time joining us, to view who is speaking on Zoom, please put your view on Speaker View instead of Gallery View. The button for this is located on the top right corner of the Zoom video screen. Si c'est la première fois que vous vous joignez à nous, veuillez changer votre écran au mode Speaker, en anglais, pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin the interpreters Christopher and Marie-Jacques or follow along on YouTube. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes Christopher et Marie-Jacques ou suivre la diffusion sur YouTube. Today, we'll be hearing remarks from Mayor Jim Watson and the Medical Officer of Health at Ottawa Public Health, Dr. Vera Etches. We will also have Dan Chenier, the General Manager of Recreation, Cultural and Facility Services, as well as Marie-Claude Turcotte, Manager of Immunization at Ottawa Public Health, that will be able to answer reporters' questions. Aujourd'hui, nous allons avoir la participation du maire Jim Watson et de la médecin-chef en santé publique à Santé publique Ottawa, Dr. Vera Etches. Nous avons aussi la participation de Dan Chenier, le directeur général des services des loisirs, de la culture et des installations, ainsi que Marie-Claude Turcotte, gestionnaire du programme d'immunisation à Santé publique Ottawa, qui seront disponibles pour répondre aux questions. I will now hand it over to Mayor Watson for opening remarks. Mayor Watson, c'est à vous.
Merci beaucoup, Max. Thank you very much, Max, and good afternoon, everyone. Bonjour tout le monde. Current indicators show a significant increase in the number of people testing positive for COVID-19 over the last 2 weeks. Les données actuelles indiquent une hausse importante du nombre de personnes qui ont obtenu au cours des deux dernières semaines un résultat positif à un test de dépistage de la COVID-19. I know people are concerned, and I want to assure residents that the city and Ottawa Public Health will continue to mobilize resources to slow the spread and support our massive vaccination efforts. In response to the rapidly spreading and highly transmissible Omicron variant, the city's Emergency Operations Center returned to activated operations. Davantage de travailleurs de santé publique participeront de la campagne de vaccination. Nous faisons tout notre possible pour offrir le maximum de doses de rappel. The city has also put additional health safety measures in place, including capacity and social gathering limits, to help curb transmission and safeguard our hospital system and ICU capacity. Excuse me. You'll hear more about this from Dr. Etches in just a moment. When the province expanded eligibility this week to all adults in Ontario, all available COVID-19 vaccine booster appointments in Ottawa were quickly booked up on Monday morning. To date, nearly 170,000 third dose booster shots have already been administered in Ottawa, and we're increasing capacity to around 9,000 doses per day for clinics. Going forward, there are more than 107,000 bookings for third doses in Ottawa from now until the end of January. Additional appointments will be added. We will update residents as they become available. I want to stress that all eligible residents who want a booster shot will in fact get one. I want to thank OPH and city staff for their incredible efforts in ramping up our vaccine capacity. If you still haven't received your first or second dose, I'd urge you to do so as soon as possible. At this critical time, we all need to do everything possible to slow the spread of COVID and protect each other and every member of our community. Pendant la période des fêtes de fin d'année, les contacts devront malheureusement être limités et les mesures de distanciation physique respectées. I want to touch briefly on the subject of rapid test availability in Ottawa. Last week on a call with elected officials that included MPPs from Ottawa, I raised the need for faster deployment of rapid tests in Ottawa and increased capacity. Ottawa residents shouldn't have to line up at 4 a.m. to collect a rapid test. I'm again asking the province to prioritize Ontario's second largest city to receive additional rapid tests as soon as possible. For those who have the tests, I would add a note of caution. A negative result does not give you a free pass to ignore public health guidelines. We're still asking you to follow all public health guidelines including limiting your close contacts, regardless of what a rapid test says. Regarding the recent news about the outbreak among our paramedic service, I found the news to be extremely disappointing and frustrating. I've always considered our paramedics to be some of the best in the country, and they hold one of the most honorable professions. The speed and ease at which this virus spread through the paramedic service shows just how tenacious and damaging the virus can be. Ottawa Paramedic Service has instituted enhanced infection control measures and is working closely with OPH to identify close contacts. Presently, there are minimal impacts to the service, including to our paramedic immunizers and ambulances. Excuse me. Finally, I want to end by thanking you, the residents of Ottawa, for being caring citizens and neighbors, for getting vaccinated, and for doing your part for the greater good of our entire community. I also want to thank our incredible healthcare workers who will be working through the holidays to protect our residents, particularly those who will be working at vaccine clinics that will be running on Christmas Day and New Year's Day. I know this is not how they wanted to spend their holidays, so let us all return the favor by getting our booster and doses and following all public health guidelines. Thank you. Merci beaucoup. I'll hand it over to Dr. Etches.
Thank you, Mayor. Bonjour, Quay. As more people in our community and across Ontario continue to test positive for COVID-19, it is critical that we do what we can now to reduce COVID-19 transmission to protect ourselves, our families, our communities, our hospitals, and our healthcare capacity. And the number of people testing positive, it's in a day, it's really approaching the heights we've ever seen, such as last April of this year. And more than that, the number of contacts that people have is also very high. So this is leading to a lot of pressure on the system. And as we announced last week, we continue to ask individuals who test positive to notify their own high-risk contacts to advise them that they may have been exposed to COVID-19. Comme nous l'avons annoncé la semaine dernière, nous continuons de demander aux individus qui testent positif pour la COVID-19 de l'annoncer à leurs contacts à haut risque pour les aviser qu'ils ont potentiellement été exposés à la COVID-19. It is individuals who test positive that will be contacted by Ottawa Public Health or by a provincial COVID-19 workforce, and they will be supported and provided with information about how to tell their high-risk contacts. And I know, part of the system is, to recommend testing of high-risk contacts, and so there's been a lot of frustration around access to testing in Ottawa lately. Residents are looking for better access to rapid antigen testing, as the mayor mentioned. Many people may be interested in using the rapid antigen test to make decisions about how to gather over the holidays. And so I do appreciate this interest in using all the available tools to be able to, try to increase the safety of our gatherings. It is something the provincial and federal governments are working on to be able to grow that supply of rapid antigen tests. So we think this is coming in the new year. For now, what we see with the assessment centers and the care clinics that are providing PCR testing is that they're working to continue to increase capacity. So they are looking at Ontario Health that runs the testing system is looking at bringing in third-party providers. There are others working on instituting new points of access. So at this time, though, today, I know it feels different because Ottawa's testing sites are prioritizing healthcare workers with access to testing to help prevent staff shortages in our hospitals, in our long-term care homes. So drop-ins at testing sites will be declined testing due to the capacity constraints so that testing can be available for these essential workers who need an urgent test. À l'heure actuelle, les sites de dépistage à Ottawa priorisent les tests de dépistage pour les travailleurs de la santé afin de prévenir les pénuries de personnel. Et les personnes qui se pointent sans rendez-vous ne seront pas acceptées en raison de contraintes de capacité pour que le dépistage puisse être disponible aux travailleurs essentiels et aux travailleurs de la santé qui ont besoin d'un test urgent. But as I say, I know they're continuing to work on solutions. Our partners, the Ottawa COVID-19 testing task force overseeing the operations and Ontario Health. And they're working to implement as well any new guidelines that would come from the province where more prioritization may be needed that will be following provincial guidelines. So without testing, it is possible, the testing detects the infection after it's occurred. We can still take steps to protect our loved ones by preventing the COVID transmission in the first place. It is the actions we take today and tomorrow and into the future that matter, and we know how to do this. We've been doing it well for the last many months, and thanks to your actions, I know we can continue. So the next topic is about what do we do then? With or without a test, if we think that it's COVID there is new information on isolation guidance. So I want to be clear about this. It's been hard necessarily to absorb all the changes that are happening. And so I would recommend people continue to go to the Ottawa Public Health website for guidance about isolation. It will have the latest information. And so at this time, under updated provincial protocols for case and contact management, which Ottawa Public Health is aligning with, it's all household contacts of individuals who test positive, either using a rapid antigen test or a PCR test, or if people have COVID-like symptoms, these household contacts, and the person with symptoms, the person with the positive test, all must isolate for 10 days, except to go get tested. And that is regardless of your immunization status. And à l'heure actuelle, en vertu des protocoles provinciaux mis à jour concernant la gestion des cas et des contacts auxquels s'aligne Santé publique Ottawa, tous les membres du ménage d'un individu qui est positif pour la COVID-19 ou qui a des symptômes de la COVID-19 doivent s'auto-isoler pour 10 jours, sauf pour aller se faire tester, peu importe leur statut vaccinal. Nous vous demandons aussi de l'annoncer à vos contacts à haut risk. And this is because we're seeing with the Omicron variant that it's much more transmissible within a household, and that the vaccination doesn't necessarily limit that transmission to the same degree. So there are a lot of nuances and details, some changes to the provincial approach to self-isolation for people who are high-risk contacts, and our website will have the latest information for you. When it comes to the vaccine rollout, we are continuing, and I must thank the tireless team, the Ottawa Public Health team, but the hospitals, the physicians, the pharmacies, the community health and resource centers, all of our healthcare partners who are really, they are doing almost as much as they ever have, again, as well as on the case and contact management side. We're really at some of the heights of the volume of work on all fronts right now in this pandemic. We have made progress on increasing vaccine coverage in Ottawa, but we will continue every day of the holidays coming up and into the new year. Of course, it is Ottawa residents, yourselves, I'm so thankful for, that are coming forward and taking up the appointments and protecting themselves and their loved ones in the community. Well, we've doubled our capacity to over 9,000 appointments daily. We are working to grow this. We don't have an upper limit. We're not going to stop. We're working around the clock to keep adding in appointments. Last Saturday, we added an additional vaccination site at the EY Centre to accommodate up to 2,700 people a day. And so we broke our own record for the number of vaccines administered in one day at one community clinic there. And we're looking to add another large site. So it's to date that 89% of Ottawa residents aged 5 and over have received their first dose. 82% are fully vaccinated with 2 doses. And 64% of people in their 80s and older, and 56% of people in their 70s have their booster dose. So we'll continue to work hard to make sure that those percentages protected with a booster dose grow. And as hard as it is for me not to be able to provide better news before the holidays, I know this is even harder for you to hear it. So I did want to offer a little bit of hope, what I'm seeing in different forms. Of course, I feel very hopeful because our team is rallying once again to ramp up vaccination. I'm seeing hope in the form of low hospitalizations for now. And I'm seeing hope in the knowledge that our actions can keep people out of hospital into the future. I'm seeing hope in the form of city supports for those who may need help to isolate over the holidays. So this help can be accessed by calling 311. We know that people shouldn't have to go hungry because they can't get groceries if they're self-isolating. These kinds of practical supports are needed again as the number of people isolating in our community grows. So thank you to those reaching out to neighbors to help out. I have hope because our city and our community and our healthcare providers who've been by our sides are not stopping. And I have hope because we are in a much better position with the vaccine, because we have more protection from the vaccine now than a year ago when almost nobody in Ottawa had any vaccination protection. So I want to add to our media partners. I don't know if this is the last time we'll speak before the holidays are over, but I wanted to take this opportunity to extend my thanks for your coverage and your reporting on the pandemic over 2 years now. I know it's not easy and it's often thankless. When it gets hard, know that your work has directly saved lives. And our residents look to you for timely and accurate information. It's not an easy task when the information keeps changing so rapidly again in these last days. And on behalf of Ottawa Public Health, I sincerely thank you from the bottom of my heart for what you're doing yesterday, today, tomorrow, and beyond. Au nom de Santé publique Ottawa, je vous remercie sincèrement du fond du cœur d'avoir fait ce que vous faites hier, aujourd'hui, demain et au-delà. Je sais que les nouvelles ne sont pas toujours faciles à entendre, mais c'est grâce à la patience et au soutien de chaque personne que nous allons mettre fin à cette pandémie. So thank you, merci, and miigwech. I'm wishing everyone a happy, healthy holiday.
Okay, thank you very much, Dr. Etches. Merci beaucoup. Before moving on to questions, I would just like to remind folks that we do have Monsieur Chenier and Madame Turcotte available to answer any questions as well. Avant de poursuivre vos questions, j'aimerais bien vous rappeler que nous avons aussi la participation de Monsieur Chenier et Madame Turcotte qui sont disponibles pour répondre aux questions aussi. I will now invite each media agency in alphabetical order to ask their questions. Please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question ainsi qu'une question de suivi. We will start with the Arab Canada newspaper with Zuhair Al-Shair. Over to you. Zuhair, are you there? All right, we might look back then. We'll go to the Barhaven Independent, Charlie Sinek. Charlie, over to you.
Hi there. My question is for Dr. Etches. First of all, I want to start off by wishing you happy holidays as well. Hopefully you'll be able to get some rest over this Christmas period. My first question is really regarding, testing capacity just isn't there. People are being told to self-isolate if they're showing any COVID symptoms. Because of the demand, proper contact tracing can't be done. I know personally I'm seeing more and more posts on social media of people posting that they've tested positive despite being fully vaccinated, despite following all proper guidelines. Realistically, COVID can be spreading here in Ottawa much faster than we currently know. Is that a concern for you?
Oh, I have no doubt that we have widespread transmission of COVID in Ottawa, much beyond what we are detecting. Absolutely. It's why we needed the public health measures that are going to restrict capacity, that are sending the message that the smaller the gatherings, the better. Now is the time, to limit our contacts. I'm thankful that people are doing this. But yes, these are the prevention measures that need to be in place, that we're monitoring, are they strong enough? We'll continue to look at, the pressure on our hospital, I think, is a key indicator. Hospitalizations has always been a key indicator. It's not as affected by, people don't pretend to go to the hospital. They really have severe illness. They're tested when people go to the hospital with respiratory illness. So this is a marker and something we're watching. The percent of people testing positive is so high. We know that not everyone's presenting for testing. So that shows us also there is a lot of COVID in the community. So it is the case. We don't need that test to take the steps that will limit ongoing transmission. We do know that if you stay home when you're sick, that will help, keep COVID from growing. And what we're seeing is it needs to be your household as well, because it's that transmissible. Whether you're vaccinated or not, in a household, when one person tests positive, we can expect that others will turn positive. So that's a lot of isolation. It's 10 days from when you started the symptoms, but it will enable us to keep things manageable. It will protect more vulnerable adults prevent it from reaching them.
And my second question is, we've seen these new round of restrictions coming up this past weekend. It will take a while before we know the full effects of these restrictions and whether or not they're working to at all slow the spread of the virus within this wave. Do you think more restrictions need to come into effect to help limit close contacts even more? You mentioned we're seeing people have a long list of close contacts whenever people are testing positive, maybe the closure of all non-essential businesses or anything like that?
We had a lot of discussion about what measures were needed with the province, and the provincial action has come into place. You're right, just a few days ago. So it will take some time to see how that is going. If we look around the world, I think some places are needing to go further, and that is a possibility. I'm sure what we're all watching again is the hospitalizations in terms of how much severe illness is following, and we want to act sooner rather than later. If we start to see the hospitalizations growing, we know that things can change quickly. We're really looking at this day by day, every day. So I can't rule out that we would need to take more measures, but we'll see how things go with what's been put in place right now.
Thank you, Dr. Etchers. Thank you, Charlie. Next up, we go to CBC Ottawa, Kimberly Molina. Kimberly, over to you.
Hi there. Thanks very much. I had a question with regards to the paramedics. We've been following the situation with the large number of paramedic staff that have been deemed high-risk contacts for COVID-19. I know that the mayor touched on this, but is there, or are you anticipating any sort of ripple effect on operations, testing, vaccination efforts, just because of that sheer number of paramedics who are currently isolating?
I can offer a comment based on a briefing I had from the paramedic service, Kimberly, that they indicated it would not have an adverse impact on their ability to provide paramedics to the regular service and ambulances, as well as to the vaccination centers. So at this stage, he does not see it as posing a risk to the public in terms of public safety and access to paramedic ambulance services.
Okay, and so that's expected kind of into the future as well, and even short term?
Yeah, we have to, obviously those individuals have to self-isolate for 10 days, so that takes a number of people out of the system. But he's assured me and members of council that they have the resources to backfill any need. If that changes, we'll obviously let you and the public know.
Okay. And I just had a quick follow-up for Dr. Etches. You also touched on the hospitalizations. They're remaining low, but that is despite the fact that Omicron seems to be kind of well within the community, and it was spotted here nearly a month ago. Can you explain sort of why you think hospitalizations are still currently quite low?
So it actually is very recently that we're seeing this rapid rise of Omicron. It's happened so quickly. In our wastewater, we weren't detecting Omicron until December 10th. That's just 12 days ago that was first detected there. So it it does take time for people to develop an illness, an infection, and then become so ill that they need to attend hospital. So there's just that lag. The other thing is it's older adults and unvaccinated populations, older unvaccinated people especially, that would be greatest risk for hospitalization. And so that population may not be the first in our community to be infected. In fact, we see the rates are highest among young children, who are very unlikely to be hospitalized with COVID. And then middle-aged adults as well, again, less likely to be hospitalized. So what we know, though, it doesn't take long, and especially with Omicron, and especially if people aren't being careful with gatherings over the holidays between generations, that this can reach the population at greater risk of hospitalization. And so, the basic measures do help to protect against that. I would encourage people to continue limiting their gatherings, wearing masks indoors, distancing. Each of these levels of protection helps, and we're continuing to work on the vaccination, of course, too. But around the world, when we take a look, hospitalizations follow a rise in people testing positive for COVID. So that's what we're trying to protect against. That's why we're really thankful that people are taking this seriously.
Thank you very much.
Thank you very much, Kimberly, Dr. Etches, and Mayor Watson. Next up, we have City News Ottawa, Deborah Ryder. Deborah, over to you. Deborah, are you there? Okay, well, we might loop back. We have then CTV Ottawa with Ted Raymond.
I'm here.
Oh, okay, go ahead.
Thank you. Just wanted to ask, there was a seminar at CHEO with regards to the vaccination and with the double vaccination before the booster. One local doctor there mentioned that it's only 35% protection capacity. Could you explain, as you are accelerating the vaccination rates of 9,000 people per day, what are the benefits of just one shot?
Well, the benefit of one shot is that you're on your way to being fully vaccinated with the 2 shots and then having the booster. So really, we do want people to have 3 doses for the full level of protection. When people don't have any vaccination, they're going to be at highest risk. When people have 1 dose, that's preparing their immune system. In 2 doses, the vaccine effectiveness we saw with previous variants was very good. We are seeing these lower levels of vaccine effectiveness against infection. So there's a difference when people are looking at measures of effectiveness, whether they're looking at just you get an infection or you get a serious infection. So the lower levels of effectiveness seem to be about any infection. Fortunately, a booster brings that back up, and fortunately, there is still protection, it's looking like, against severe disease. So I don't have definitive numbers. Everyone's still studying this, but I can tell you, if you haven't had your first dose, it is worth it. You should still come out and get your first dose. You can get your second dose just 3 weeks later. I am sure we are still going to be an Omicron surge in 3 weeks. So you'll have better protection still in this Omicron surge in 3 weeks, and then you'll be able to get your booster dose 3 months after that to be protected into the future. So people without their first or second dose can drop in to our clinics. They are a priority to reach because it's the severe disease that we're most worried about, and vaccination will protect against that.
Okay, but there's just different levels of severity. If you've got a booster on top of this, you're 85% more secure than with 1 shot, or 2 shots at 35%. Is that correct? The severity of the impact of the illness is
I don't think you could interpret it quite that precisely. No, but because nobody has perfect numbers, and it's not really in comparison to. We don't have that breakdown by first, second, and third shot. What we know is that vaccination does protect against severe infection with COVID. And the third dose makes a difference when it's Omicron. So
Okay.
best to get started on your 1, 2, and 3 doses.
Okay. And you kind of you talked about the rapid tests, but you mentioned that they're only coming, the province is only bringing them in the new year. Is that, could you clarify that for me, please?
I believe the province is working with the federal government around supply of rapid antigen tests, and I believe they're expecting some deliveries in the new year.
Okay. So nothing, the status quo for rapid tests access in Ottawa will only happen in the new year?
What we have right now in Ottawa is every school child is being sent home with a package of 5 rapid antigen tests. So that's helpful in this age group where we've seen some of the highest rates of COVID. People can use those rapid tests over the holidays and know if there's been exposure to COVID before they head back into school. We know some businesses have a supply of rapid antigen tests and they're able to use them to maintain their workforce surveillance. There are some who are able to pick up tests at these holiday drop stations, but I am sure that is a very challenging situation. I'm hearing there's a lot of lineups. So what I'd like people to know in Ottawa is I understand, I wish there could be more tests for you, but you can still take the action that will protect others without having a COVID test. When you have symptoms, assume it's Omicron and stay home for those 10 days with your household. That will really help us decrease the ongoing transmission in the community.
I thank you so much for your questions. Thank you. Answers. Bye-bye.
Thank you, Deborah. Thank you, Dr. Etches. We'll now move on to CTV Ottawa. Ted Raymond. Ted, over to you.
Hi there. Thank you. My first question will be for Dr. Etches. I wanted to ask about the guidance on self-isolation with testing capacity being at its limit. So you're saying that basically if someone in your household has a symptom of COVID-19, and maybe it would help if you could go over some of the more common symptoms with us just for people to know what to look for. If they have one symptom, everyone in the household has to isolate for 10 days. Can you just sort of address maybe some of the concerns about, how to make that feasible for people, because people would still have to go to work. They might still have to get things done. Is it just a runny nose and the whole household is locked down for 10 days, or what is the threshold here?
Yeah, it is tough. We're in tough times right now. There's no question with so much COVID in the community, and so the kinds of symptoms that could be COVID would be respiratory symptoms like a cough, like a runny nose, feeling fatigued, sore muscles. People mention sore backs, but lots of things cause sore backs. So the cluster of symptoms points you more in the direction of Omicron. But it is the most protective approach. If you have one of these symptoms, that is when we would say it could be Omicron, and we are asking people to stay home and isolate. That isn't possible for everyone. Some people are in essential roles where we need society to function. We need our water treatment to occur. We need nurses in our intensive care units. So there is more finer guidance around when to self-isolate on our website. I do recommend that people check Ottawa Public Health's website because it will provide exceptions and ways to approach this in different situations. The reason we say household is because when it's Omicron, we are seeing it spread within the household. And so it's something we would ask people to consider. You may become infectious for COVID because someone in your house has symptoms, and then you don't want to pass it on to someone who's more vulnerable. So it is about then limiting your activities. There are essential activities that people may need to do, but doing them, getting help through that 10-day period, really treating it as an opportunity to stop COVID from going further. this is where we're at right now. I do believe we'll be able to continue to grow some better access to testing, so that will help people understand if it is COVID or not, and be able to try to limit how many people are isolating without knowing.
Okay, and I did want to follow on that question, Dr. Etches, just with regard to growing that access. You mentioned off the top the possibility of bringing in some third-party groups to help with this. Can you elaborate on what that would look like and how that would grow the testing capacity?
So we have it's Ontario Health that works with our testing partners, where that we've flagged to them. They've seen there's just more demand than capacity right now at our assessment centers. So it's something they're exploring to bring a company in, that it's not a hospital, that could set up in a new site to provide more access, or to help out at the existing sites. They're trying to get this. Also, our existing providers are really thinking outside the box. They're thinking about other ways to increase access to testing beyond the model that we have right now. So I am hopeful that we will be able to get people their access to testing, to grow again. So we're speaking to a moment in time right now, today, where there is limited access. It's not ideal, but I think there more solutions will be coming. Everyone is working on this, all the testing task force partners.
And so, but when you say a company, do you mean something like Life Labs, just as an example, like a company like that?
It could be something like that.
Okay, thank you.
Thank you very much. Next up, we have Global News with Craig Lord. Craig, over to you.
Thank you very much. Dr. Etches, I'm just wondering if you can help point to where the pain points are actually in our testing capacity right now. Is it a lack of actual kits or people to administer the tests, or is it capacity on the lab side? Can you help kind of explain where we're having trouble meeting up with the demand driven by Omicron?
I'm not the best person to speak to the testing system, how it's operating. So I'll tell you what I understand, but I'm not running them, so it's harder for me to speak to it. What I gather is that it's really about people in the end, that we don't have the people, not only to take the swab, a nurse or somebody who's doing the swabs, but also on the data entry side. Because we are looking, in different places, like Ottawa Public Health makes take-home kits available in schools. We're looking to see, can we increase the take-home aspect of PCR testing? It still requires some data entry to get that information into the laboratory systems, into the way that it can be processed and reported on. So I do gather that our labs, the people who actually analyze the samples, have some capacity still. And so it's about overcoming this intake of the samples, the taking of the samples, the intake, and the labs still have some capacity to provide results. So this is why everyone's looking at some different ways of approaching this that haven't been tried yet.
Mm-hmm. I think I've read on, and obviously you just mentioned you might not be able to speak to the specifics of this, but I know that some of the community health centers have shut down their testing operations and moved to the vaccination front to put more resources there. Can you speak at all to the strategy there? Obviously, both testing and vaccination are important right now, but why is the booster shot rollout maybe being prioritized right now over getting those tests as quickly as we possibly can?
Right. It's because the vaccination is what will save lives. So it is important. If we had to choose between a test and a vaccine to an older adult, we want that older adult to have the vaccine as soon as possible, in the midst of Omicron spreading rapidly in the community, where we know that booster dose can help. So I believe the community health centers are focusing on older adults. making sure that they can have those boosters where they might not have had the access previously. The testing, we do want people to be able to know if it's COVID or not, so they're not isolating unnecessarily, but it doesn't require a test to take the protective action, right? We can still protect people against COVID transmission by isolating when we're sick. And so that's why it would come as a secondary priority.
Great. Thank you very much.
Thank you, Craig. Thank you, Dr. Etches. Nous allons maintenant procéder au journal Le Droit avec Julien Paquette. Julien, c'est à vous.
Oui, bonjour. Bon, il y a des lacunes, pas des lacunes, mais il y a des besoins assez clairs en termes de personnel, que ce soit du côté de la vaccination ou du dépistage à l'heure actuelle. Alors, je me demandais, on a vu par exemple la Ville de Montréal hier déclencher un état d'urgence à nouveau. Est-ce que c'est quelque chose qui pourrait être considéré à Ottawa pour essayer justement de donner un coup de main à ces besoins personnels-là?
Oui, peut-être je vais répondre à cette question, Julienne. J'ai posé la même question à notre personnel et notre directeur général il y a 2-3 jours. Il dit, pour le moment, ce n'est pas nécessaire pour une autre déclaration d'urgence à la Ville d'Ottawa. Nous avons tous les pouvoirs de faire des choses pour améliorer la situation ici à Ottawa. Alors, ce n'est pas nécessaire, mais si Dr. Etches ou M. Kanellakis me demande pour une déclaration, certainement, je vais signer cette déclaration. Merci.
Et pour moi, je voudrais ajouter que c'est urgent. Pour nous, nous avons un processus comme pour une situation urgente. À la ville, c'est activer notre centre d'opération urgente. Et à Santé publique Ottawa aussi, on a une structure d'urgence, une réponse urgente. C'est chaque jour, on a un plan pour action qui est rapide et concentrée sur les priorités de vacciner et répondre aux migrants. La déclaration, c'est plus un peu d'aider avec accès aux ressources. Et nous avons le soutien de la ville déjà. Alors, c'est correct maintenant.
Attendez. Vous m'entendez? Excusez-moi, j'ai eu un
Oui.
message.
C'était coupé.
Oui, parfait, excusez-moi. Donc, la question, en fait, c'était en lien avec... excusez-moi, je suis perdu bien raide. Je suis désolé. J'ai oublié ma question. Je suis désolé. Vous pouvez passer au prochain.
C'est correct, Julien. Si jamais tu as d'autres questions, tu peux nous envoyer un message au PH Media à ottawa.ca et puis on va vous aider.
Merci.
Bien sûr. Okay, next up, we're going to go to the Ottawa citizen, Taylor Blewett. Taylor, over to you.
Thanks so much. I'm hoping, Dr. Etches, that you'd be able to, just to clarify, if someone has symptoms or tests positive on an antigen test and can't access a PCR test, for the household members, when do they actually begin their 10-day self-isolation period? Is it, when that person's, when their household member's symptoms started, when that person tested positive, just to get a sense for when that 10-day period actually starts?
Yes, I'm just checking to see if there's anyone actually here from our case and contact management team who wants to verify, but it's tricky in a household. It really is because people can continue
Recording in progress.
Sorry.
Recording stopped.
I just had an interruption, sorry. So what we know is when someone gets symptoms, we ask them to isolate for 10 days. And certainly during that 10 days, there is some infectiousness where they could expose household members. And typically then if a household member becomes positive, it's 10 days from when they became positive or they had symptoms, they would do another 10 days. But to begin with, if it's the 10 days. So if household members, someone who's sick, isolate for 10 days, that's the initial piece. But what happens is if they then develop symptoms, they themselves would need to go an additional 10 days. So it can be challenging. What helps is if the household members can increase their isolation, their distance from the person who tested positive. That does help within a household if it's possible, decrease the chance of the infection being passed on and the need for another extension to the isolation.
Right. So just so I can make it, very clear when we're communicating to household contacts, because I had heard from the testing task force, for instance, that, high risk contacts of a household contact, they would have to self-isolate from 10 days to the last exposure to that person, right? So I'm trying to understand, is it that if you're a household member, if you don't develop symptoms, all you need to do is the 10 days alongside that person who either tested positive on an antigen test or has symptoms. And if you don't develop symptoms, you're all good. After that 10 days is up, you can go back to normal life?
That is my understanding, yes. So if in that 10 days that the person who's tested positive is isolating, nobody else gets a positive test or develops symptoms, then everyone can go after the 10 days. Ideally, if you can decrease the contact during that period, that helps. But if somebody else does become sick, then it starts over again.
Right. Okay, thank you.
Thank you very much, Dr. Etchers, and Taylor. Thank you as well. Next up, we go to the Ottawa Sun with John Whitling. John, over to you.
Thanks, Max. On the paramedic outbreak, I'm wondering, either Dr. Etches or anyone else at OPH, does anyone know if any of the 93 patients considered close contacts in the paramedic outbreak tested positive, or if there are any more close contacts patient-wise identified who have tested positive for COVID-19?
I'm sorry, I don't get involved in the details of case and contact management, so I don't have that information. I'm sure that our team is following up, though.
Okay, thanks, Doctor. Mayor Watson, I think you might be the best position on this call to address some more paramedic-related questions. Did paramedic management suggest to you what the number is in terms of paramedics who are sidelined from COVID-19? What number presents a real service impact to the city of Ottawa? So, for example, we've learned of 30 paramedics being sidelined as per yesterday. What is the number where we really get concerned about paramedicine service in Ottawa?
Yeah, I think that was 30 out of approximately, my understanding is there are 130 at the social event that caused the outbreak, John. You really have to get that from Pierre Poirier. He indicated certainly to me and to members of council in the last 2 days that they had the capacity and the depth to ensure that there were going to be no significant drops in service. Both those paramedics, as you know, who are helping out at vaccination centers, as well as those who are obviously on the road with their ambulances. So, he will let us know if there is going to be a significant or any type of a cut in service, but at this point he believes that it can be handled with the existing resources that they have.
Great. Thanks, everyone. Happy holidays. Take care.
Thank you.
Thank you, John. Thank you, Mayor Watson. Thank you, Dr. Etchers. Nous allons maintenant passer à Radio-Canada avec Frédéric Pépin. Frédéric, c'est à vous.
Oui, parfait. Alors, ma première question pour vous, Monsieur le maire, Monsieur Watson, c'est pas ma vraie question, mais ce que je veux vraiment savoir, c'est comment allez-vous? La santé?
Merci pour la question, Frédéric. Oui, je suis bon, pas des symptômes. Alors, le 27 décembre, c'est le jour que je suis libre de ma maison ici dans la ville d'Ottawa. Et je dis merci beaucoup à mes amis qui me fournirent avec les repas et des choses importantes comme jus d'orange et lait, des choses comme ça. Mais comme j'ai dit, je n'avais pas des symptômes pour COVID-19. mais juste suivre les règlements de santé publique et faire, c'est pas le mot français, self-isolated pour 10 jours.
L'isolement. Mais M. Watson, ma vraie question pour vous, c'est, et je suis content d'entendre que ça va bien, la vraie question pour vous, c'est de savoir, là, du côté du Québec, on parle peut-être de fermer les frontières ou de limiter l'entrée. Là, nous, on est à Ottawa, on est tout près de Gatineau. On s'en rappelle, ça fait pas très longtemps que les frontières étaient contrôlées. C'est quoi un peu votre opinion là-dessus sur ce qui pourrait arriver si on doit fermer à nouveau?
Mais comme tu sais, Frédéric, on a essayé ça, la province de l'Ontario a essayé ça il y a quelques mois et malheureusement, ça marche pas très bien parce qu'il y a des autobus qui avaient l'accès, il y a des personnes qui travaillent dans un hôpital à Gatineau et habitent à Ottawa et vice-versa. Alors, je ne pense pas que ça, c'est une idée qui est une bonne idée. Parce qu'on avait l'histoire avec cette proposition il y a quelques mois, quand M. Ford a déclaré que les frontières sont fermées. Et ça coûte beaucoup de l'argent en même temps pour le service de police. Je pense pour le premier jour, c'est plus de 130 000 $ pour une protection de la frontière pour 24 heures par 24 heures. Alors, je ne pense pas que ça, c'est une priorité maintenant. C'est plus important pour nous autres de convaincre des résidents de les deux côtés de la rivière de rester chez eux, de respecter les règlements de santé publique et ça, c'est prendre une vaccination tout de suite si ça, c'est possible. Merci.
Ma deuxième question sera pour la Dr. Etches. Dr. Etches, vous avez parlé maintenant comme quoi que la priorité pour le dépistage, c'est pour les travailleurs essentiels. Ça, c'est officiel en tant qu'aujourd'hui à Ottawa, là, si je ne me trompe pas. Qu'est-ce qu'on dit aux autres gens qui ont des symptômes, qui ont un test rapide qui dit que c'est positif et qui se sentent... Est-ce qu'on leur dit, si vous n'êtes pas un travailleur essentiel, n'allez pas au centre de dépistage?
Je voudrais que la population continue d'accéder les dépistages s'ils sont disponibles. Alors, il y a les centres de dépistage. On peut essayer de trouver un rendez-vous. Sinon, il y a peut-être d'autres options, mais je sais que c'est difficile. Alors, si on n'a pas accès au dépistage, l'avis, c'est d'être isolé pendant 10 jours parce qu'avec Omicron, c'est possible d'avoir une infection transmissible pour les 10 jours, 10 journées. Alors, ça, c'est une action qu'on peut prendre pour protéger les autres et diminuer la transmission de COVID dans notre travail et notre communauté.
Si je peux me permettre une précision, Dr. Etches, le dernier point de presse, vous aviez dit qu'on attendait un mot d'ordre de la province avant de prioriser le dépistage. Alors là, est-ce que c'est la santé publique à Ottawa qui a décidé non, il faut prioriser parce qu'il y a trop de demandes? C'est quoi un peu qui a mené à cette décision-là?
Non, ce n'est pas Santé publique Ottawa, c'est le système qui offre le dépistage. C'est Santé Ontario qui gère le système pour le dépistage. Et maintenant, Santé Ontario essaie d'augmenter la capacité à Ottawa. Ils ont des idées d'augmenter la capacité avec d'autres business, entreprises qui peuvent offrir le dépistage. Aussi, les partenaires qui opèrent, qui gèrent le système de dépistage des hôpitaux, ils ont des idées maintenant d'augmenter le point d'accès différemment. Ils explorent comment on peut augmenter la capacité parce que notre laboratoire a une capacité un peu plus et on peut juste on a un défi avec le nombre de travailleurs qui peut aider avec le système de préparer le dépistage, d'offrir le dépistage. Et c'est pas quelque chose en juste accepte maintenant. On travaille fort. Les partenaires dans le système de dépistage travaillent fort pour améliorer la situation.
Est-ce que vous dites que c'est Santé Ontario qui dit que ce sont juste les travailleurs essentiels qui peuvent se faire dépister présentement ou que c'est eux la priorité ou c'est vous et la santé publique d'Ottawa qui a décidé ça?
Non, ce n'est pas moi.
Non, d'accord.
C'est Santé publique d'Ottawa qui gère le système de dépistage. C'est Santé Ontario. Mais Santé Ontario n'a pas une politique maintenant qui a changé pour la population qui peut accéder le dépistage. C'est juste les opérations ici par terre. Les hôpitaux qui n'ont pas la capacité de tester tout le monde qui arrive. C'est pourquoi dans les centres, ils ont besoin de prioriser les travailleurs en santé. Mais il y a des rendez-vous encore. Si quelqu'un a la possibilité de prendre des rendez-vous, je continue de recommander ça. Et je pense que le nombre des rendez-vous va augmenter dans l'avenir parce que les opérateurs des centres de dépistage essaient d'augmenter la capacité encore. Et il n'est pas une politique, le système est là pour tout le monde encore, mais c'est plein, je comprends.
Merci et merci Frédéric. On va devoir passer aux autres journalistes avant de continuer. Merci beaucoup, Dr. Etches. Merci beaucoup, Frédéric. Nous allons maintenant procéder à TVA Gatineau-Ottawa avec Louis-Charles Poulain. Louis-Charles, c'est à vous.
Oui, bonjour à tous. Mon collègue en a fait mention. Au Québec, on s'apprête à annoncer de nouvelles mesures. On sait déjà qu'il y a fermeture de bars, des gyms, cinéma. Est-ce que vous avez un message? Peut-être, est-ce qu'il y a des gens qui pourraient, peut-être de l'Outaouais, avoir envie de traverser en Ontario à Ottawa pour aller, par exemple, au cinéma? Est-ce que c'est quelque chose qui vous inquiète? Est-ce que vous aimeriez que l'Ontario change ses mesures pour que ce soit plus similaire? C'est quoi votre point de vue là-dessus?
Mon point de vue, c'est de prioriser la diminution de COVID dans notre communauté par limiter les contacts étroits. C'est un lieu à haut risque dans les gymnases sans masque. C'est pas une bonne idée quand il y a beaucoup de COVID dans la communauté d'être à l'intérieur sans un masque. Alors, c'est possible que les mesures en Ontario vont besoin d'augmenter les limites pour réduire le COVID dans la communauté, mais on a juste nouvelles mesures cette fin de semaine. Alors, on va suivre l'impact de ces mesures. On regarde les nombres des hospitalisations chaque jour. Et s'il y a une augmentation dans la quantité de maladies sévères dans la communauté, j'imagine que ça va aussi, la prochaine étape de parler avec la province concernant les mesures. Mais pour la population en général, mon avis, c'est de limiter les contacts et éviter les situations avec un plus grand risque à l'intérieur sans les masques.
Merci. Ma deuxième question, c'est concernant la directive d'isolement pendant 10 jours. Est-ce que tout le monde est concerné par ça? Les travailleurs essentiels, les travailleurs de la santé, est-ce que également c'est ce qu'on priorise? Est-ce qu'on craint que ça pourrait avoir des répercussions, qu'on pourrait manquer de personnel parce que les gens sont isolés parce qu'ils ont des symptômes ou sont pas certains s'ils sont positifs ou non?
C'est clair, avec beaucoup de jeunes en isolation, ça peut affecter nos services essentiels. C'est pourquoi on a différentes approches. S'il y a un travailleur dans un domaine où il faut qu'on continue ce service, un service de santé ou un service essentiel dans la ville, par exemple, il y a différentes approches de prioriser les choses importantes pour le fonctionnement de la population, de la société. mais pour la population en général, l'isolation pour 10 jours, ça protège contre, ça diminue la quantité de COVID dans la communauté. C'est le même avis qu'auparavant. Si vous êtes malade, restez chez eux. Mais je sais, c'est pas facile pour tout le monde. Il y a des gens qui ont besoin d'aide avec nourriture, peut-être d'avoir l'aide urgente. Et c'est pourquoi je voudrais aussi reconnaître la ville offre des services pour les gens qui ont besoin. On peut appeler 311 s'il y a besoin de plus de soutien.
Merci beaucoup. Joyeuse fête.
Merci beaucoup, Louis-Charles, et merci beaucoup, Dr. Etches. Our last question will come from Your Community Voice with Patrick Guccione. Patrick, over to you. Patrick, are you there?
Sorry, I was on mute. Dr. Etches, I guess because of a supply issue, you're only administering Pfizer to 18 to 29-year-olds. Just wondering if you can look into January to see if that supply of Pfizer is going to increase.
It is the case that in Ontario right now, we have a large supply of the mRNA vaccines, but a greater quantity of the Moderna vaccine compared to Pfizer. So that is why we're protecting the supply of Pfizer for people who are under 30, where Pfizer is preferentially recommended. Moderna is a good vaccine. It provides potentially even longer lasting protection. Some studies are showing, so people don't have to be worried about the supply of vaccine. We have enough vaccine for everyone who wants their booster doses. And there may be more Pfizer coming in January. We don't know when, but we know that the province has asked the federal government, and the federal government is continuing to purchase vaccines. So when we have more information, we can share that, but it'll be a number of weeks, I think. And the time to get vaccinated, if you can get an appointment at a public health run clinic or a family doctor clinic or a pharmacy, really now is the time, and the vaccine that's there will be one that is safe and approved.
And just as a follow-up, are there exceptions to that rule? Because there are some people that did have reactions to Moderna.
Yes,
whether they're cardiac issues or infections. If they have a letter, say, from their family doctor, is that enough?
So the nurse or vaccinator, whoever's vaccinating, will always go through what the vaccine is and any contraindications. So they would be asking about any allergies and or other reactions after a previous dose. So that is something that would be accommodated when people have a contraindication to a vaccine. That is also a reason to look at an alternative.
And if I could just ask one question that was asked in French, Mayor Watson, could you repeat in English how you're feeling?
Yeah, thanks, Pat. I feel very good. No symptoms. Looking forward to getting out of self-isolation on the 27th of December. I'm bored to death, as you can imagine, but been continuing to work, lots of Zoom meetings and the occasional Netflix show. I've received my call from Ottawa Public Health, who had a whole bunch of questions. And as I said, no symptoms whatsoever, and look forward to the end of self-isolation on the, I think it's midnight on the 26th or 12:01 on the 27th. I'll be in bed at 12:01 on the 27th and maybe go out and get some groceries on the 27th. Thank you.
Thanks so much, and have a great Christmas.
Thank you, and Merry Christmas to everyone. Joyeux Noël à tout le monde, and thank you, Dr. Etches, the incredible work that you're doing. And I think, as I mentioned in my remarks, a lot of your colleagues are going to be working Christmas Day, New Year's Day, long hours. I'm sure it's the last place they want to be, but they know that they have such an important role to play. And we're so blessed to have so many good frontline healthcare workers and others who are rallying to the cause. We'll get through this, and here's to a better 2022. Alors, merci beaucoup, Dr. Etches et votre équipe et les membres du média pour votre rôle essentiel dans une démocratie. Thank you to the media for getting the messages out about testing and the importance of following the Ottawa public health rules. And I tell people all the time who contact me on Twitter, please go to Ottawa Public Health's website. It is a treasure trove of great information, factual information that will answer a lot of your questions. Thank you. Merci, and Happy New Year. Joyeux Noël. Merry Christmas.
Thank you very much, Mayor Watson. Thank you, Dr. Etches. So yes, reiterating, have a safe and healthy holiday season, folks. And well, maybe we'll see you next year, or maybe before that. We'll see. J'espère que tout le monde pourra passer un temps des fêtes en santé et en sécurité, et peut-être qu'on se reverra l'année prochaine, sinon pas avant ça. Donc, c'est tout le temps qu'on a aujourd'hui. That's all the time we have for today. Be well. Thank you. Au revoir.